Teeth grow in as we grow up. Our mouth, by and large, is only able to hold 28 teeth. However, by the time we are between the ages of 18 and 20, we are expected to have 32 teeth inside of our mouths. These 4 extra teeth that come into play at this age are called the third molars, but most people refer to them as wisdom teeth.
Most people who are having their wisdom teeth removed are having them out for a couple of reasons. The most common reason is as the wisdom teeth are coming in, and a lot of people that don't have room for them to come in correctly. And so what happens is those teeth don't have room to erupt into the mouth fully, and they end up being stuck kind of halfway in and halfway out. And the problem with that is you end up in kind of the worst of all worlds because you can't keep that clean. So what happens is your typical teenager who's having wisdom teeth removed now has a tooth that's halfway through the gum and halfway stuck underneath the gum and bone. And the problem is if you can't keep that clean, it eventually gets infected. On top of that, if the tooth's left long enough, what can happen is you can end up with bone loss on the teeth next to it. And what ends up happening with that is you get to be in your 30s and 40s and now you've been unable to clean that tooth long enough that you start to develop periodontal disease to the tooth in front of it. And eventually you're losing 2 teeth for the price of 1. On top of that, if you take out a lower tooth, typically when it comes to wisdom teeth, you're usually taking out the upper tooth simply because that tooth will keep coming down until it hits another tooth and there's not going to be another tooth there. On top of all of that, when you're trying to brush that upper tooth and you try to go all the way in the back and get all the way back there, sometimes you just can't get that far back and keep it clean. So it's usually a hygiene issue. Erupting wisdom teeth can cause some orthodontic crowding. You'd hate to undo all the hard work your orthodontist did prior to that. Most people that are having their wisdom teeth out are going to be a little sore for about a week. I don't want them to have any pain, so I write them for some pretty good pain medicine. Most patients are taking that for a day or 2 and kind of tapering down to something over the counter like ibuprofen. It's not uncommon to need some ibuprofen kind of on and off for the better part of a week. Now understand that's a bell curve. There are people that took 2 aspirin and they were done. And there's other people on the other hand that took Percocet for a week, but it's very uncommon to be either ends of that spectrum. Most people taking some kind of prescription medicine for a day or 2, tapering down to something over the counter, and just kind of tapering off as you go from there. Most people that are having wisdom teeth out are going to have some swelling. Now everybody has some. Some people have a little bit, so little you don't even know they had it, and other people swell a fair amount. I will tell you that the people that go home and ice it a lot do pretty well. So I recommend that pretty much if you can ice it as much as you can for the first couple days, go ahead and do it. The people that do that come back and say, you know, my friends are whiners. It wasn't any big deal.
The longer you wait to remove these impacted teeth, once they begin to grow at an angle, the more likely you are to experience additional pain and a complicated healing process.
Anytime you're taking out wisdom teeth, there are some risks and benefits that I go over with people. Anytime you take out a tooth, any tooth, there's always the theoretical risk of developing an infection. Now, infections happen, they're just pretty rare. If you do everything we tell you when you leave here, the chances of developing an infection or a condition called a dry socket are pretty small. It's just not a common occurrence. Anytime you take out a tooth on the upper arch, the roots of those teeth can sit kind of close to the floor of the sinus. Now the sinus is a cavity that sits in your skull, kind of behind your cheekbones. Rarely, very rarely, when those teeth come out, you can have a little opening made up there. If it's a small opening, it'll just heal on its own. No big deal at all. If it's a large opening, I would need to close over the top of it in a special way with some dissolvable stitches just to make sure everything's watertight up there. If for some reason that didn't heal correctly, it can theoretically require second surgery to make sure everything's watertight up there. Truth be told, I have not seen that happen from wisdom teeth unless they were really hard in an elderly gentleman. It's just not real common in a normal person. They just don't have that complication very often. Lower wisdom teeth are kind of a different animal. The roots of those teeth can sit near the nerve that gives people feeling to the front part of the lip and chin, right here and here. Now, it's a feeling nerve. It's not a moving, smiling, talking, drooling, singing, any of that nerve. But it is a feeling nerve, and rarely, really rarely, when those teeth come out, you can have some swelling around that nerve that can result in kind of a tingly feeling here on the lip and chin. Most of the time if that happens, and it's very rare to begin with, but most of the time if that happens, the studies that have been done on it show that most people get feeling back within about 2 weeks. Rarely, it could be a long-term thing, a couple of months. Really rarely, it could be a permanent thing, although I've never seen it happen, and if it's going to, it's typically going to happen to somebody who's older with really complicated wisdom teeth. The same is theoretically true for the nerve that gives feeling to the inside of the tongue, although I stopped counting when I took out about 3,000 sets of wisdom teeth, and that was back in 2007 or so. I've never seen a numb tongue. So can it happen? Yeah, but the chances of it happening are pretty darn small. I tell people it's equivalent to getting hit by lightning on a sunny day. It's not very common. That's typically done with some IV sedation, and the reason is it can be fairly stimulating to have your wisdom teeth out. It's a lot of loud noises, it's not a lot of fun, so I recommend you're not here for it. The way that works is we find a vein, we put a little bit of numbing medicine under the skin, that way you can't feel us start an IV. We start an IV. At that point we hook up to a lot of monitors, just like you're in an OR, and we kind of drift you off into la-la land. While you're off in la-la land, I numb your mouth. I give you a bunch of shots. You don't know I did it because you're asleep. But while the patient's dreaming about being in Hawaii, we go ahead and get the wisdom teeth out. And when they wake up, they're numb and they're not hurting at all. And they get to go home and put a lot of ice on their face. That's the one thing I really push on people. Typically, someone who's having wisdom teeth out will, if we had them out on a Friday, they'd probably be back to school or work by Monday. Might have a little bit of, be a little puffy at that point, but especially if they ice it, I wouldn't expect it to be a lot.